1. The human heart is a robust organ, ceaselessly working to pump blood and ensure the circulation of oxygen and nutrients to the body's tissues. 1. Heart health is influenced by numerous factors, including genetics, lifestyle, diet, and environmental exposure. 1. Scientific research continues to unveil new aspects of cardiovascular health, leading to evolving guidelines for maintaining a healthy heart. 2. Cardiovascular diseases, CVDs, remain the leading cause of death worldwide. 2. According to the World Health Organization, WHO, an estimated 17.9 million people succumb to heart-related ailments each year. 2. These diseases encompass a range of conditions, including coronary artery disease, heart failure, arrhythmias, and valvular heart disease. 2. A combination of lifestyle factors, genetic predisposition, and medical conditions such as hypertension and diabetes contribute to these conditions. 3. Different age groups experience distinct cardiovascular challenges. 3. In newborns and infants, congenital heart defects, CHDs, are the primary concern, affecting nearly 1% of births globally. 3. These defects range from minor anomalies to complex malformations requiring surgical intervention. 3. Advances in pediatric cardiology have significantly improved survival rates. 4. Children and adolescents are generally at low risk for heart disease. 4. However, the foundation of heart health is established during these years. 4. Childhood obesity, an increasingly prevalent concern, contributes to early arterial damage and increases the likelihood of hypertension, type 2 diabetes, and metabolic syndrome. 4. Encouraging healthy eating habits and regular physical activity during childhood is crucial for long-term cardiovascular well-being. 5. Young adults, typically between the ages of 20 and 40, begin to experience the cumulative effects of lifestyle choices. 5. Sedentary behavior, poor dietary habits, smoking, and excessive alcohol consumption contribute to early-onset hypertension and cholesterol imbalances. 5. Stress-related cardiovascular issues have also risen in this demographic, with research linking chronic stress to increased inflammation and endothelial dysfunction. 6. Middle-aged individuals between 40 and 60 often see the manifestation of cardiovascular risk factors. 6. This age group experiences the highest incidence of hypertension, dyslipidemia, and type 2 diabetes, all of which contribute to atherosclerosis and an elevated risk of heart attacks and strokes. 6. Regular medical screenings, dietary modifications, and consistent physical activity become essential preventive measures. 7. Older adults, aged 60 and above, face unique cardiac challenges, including age-related vascular stiffness, heart failure, and arrhythmias such as atrial fibrillation. 7. The aging process leads to structural changes in the heart, including myocardial fibrosis and reduced cardiac output. 7. Preventative cardiology plays a pivotal role in prolonging heart function and reducing morbidity. 8. Diet exerts a profound impact on heart health. 8. The Mediterranean diet, rich in fruits, vegetables, whole grains, nuts, and healthy fats, has been extensively studied and linked to reduced cardiovascular risk. 8. Conversely, diets high in trans fats, refined sugars, and processed meats contribute to endothelial dysfunction and systemic inflammation, fostering atherosclerosis. 9. Physical activity is an essential determinant of cardiovascular health. 9. Regular aerobic exercise, such as brisk walking, jogging, swimming, or cycling, enhances myocardial efficiency, lowers blood pressure, and improves lipid profiles. 9. Resistance training complements aerobic workouts by enhancing metabolic function and reducing insulin resistance. 10. Smoking and excessive alcohol consumption are detrimental to heart health. 10. Tobacco smoke contains over 7,000 chemicals, many of which are toxic to the endothelium, leading to chronic inflammation and arterial plaque buildup. 10. Excessive alcohol intake contributes to hypertension, arrhythmias, and cardiomyopathy. 10. However, moderate alcohol consumption, particularly red wine, has been linked to some cardiovascular benefits, likely due to polyphenolic compounds such as resveratrol. 11. Stress and mental health have increasingly been recognized as significant contributors to cardiovascular disease. 11. Chronic stress leads to prolonged elevations in cortisol and adrenaline, which drive hypertension and inflammation. 11. Mindfulness-based stress reduction techniques, such as meditation, yoga, and controlled breathing, have demonstrated efficacy in lowering cardiovascular risk. 12. Sleep quality profoundly influences heart health. 12. Poor sleep patterns, particularly obstructive sleep apnea, contribute to hypertension, arrhythmias, and metabolic disturbances. 12. Adults are recommended to obtain at least 7–9 hours of quality sleep per night to optimize cardiovascular function. 13. Genetic predisposition plays a crucial role in cardiovascular health. 13. Individuals with a family history of heart disease have an increased risk of developing similar conditions. 13. Genome-wide association studies, GWAS, have identified multiple genetic variants linked to cardiovascular disease, emphasizing the importance of personalized medicine. 14. Medical advancements continue to reshape cardiovascular treatment and prevention. 14. The advent of statins revolutionized lipid management, reducing LDL cholesterol and lowering heart attack risk. 14. Innovations such as PCSK9 inhibitors, SGLT2 inhibitors, and GLP-1 receptor agonists further enhance heart disease management. 15. Technological interventions, including wearable health monitors and artificial intelligence-driven diagnostics, provide real-time insights into cardiovascular function. 15. Continuous glucose monitors, smartwatches capable of detecting atrial fibrillation, and AI-powered imaging enhance early detection and personalized treatment strategies. 16. The role of gut microbiota in heart health is an emerging area of research. 16. Studies suggest that gut bacteria influence lipid metabolism, inflammation, and even blood pressure regulation. 16. Diets rich in fiber and probiotics may foster a favorable gut microbiome, reducing cardiovascular risk. 17. Gender differences exist in cardiovascular disease presentation and outcomes. 17. Women often experience atypical heart attack symptoms, leading to delayed diagnosis and treatment. 17. Hormonal fluctuations, particularly during menopause, influence lipid metabolism and vascular health, necessitating gender-specific prevention strategies. 18. Ethnic disparities impact heart health outcomes. 18. Certain populations exhibit higher predispositions to hypertension, diabetes, and metabolic syndrome, influenced by genetic and socioeconomic factors. 18. Culturally tailored interventions are essential to addressing these disparities. 19. The impact of environmental factors, including air pollution, climate change, and occupational exposures, is increasingly recognized in cardiovascular research. 19. Chronic exposure to fine particulate matter, PM2.5, correlates with increased rates of hypertension, atherosclerosis, and heart failure. 20. The future of cardiovascular medicine lies in precision medicine and regenerative therapies. 20. Stem cell research, gene editing, and tissue engineering hold promise for repairing damaged heart tissue and reversing chronic conditions. 21. Conclusion. Heart health is a multifaceted domain influenced by age, genetics, lifestyle, and environmental factors. 21. Preventative strategies, encompassing diet, exercise, mental well-being, and medical interventions, play a critical role in reducing cardiovascular disease burden. 21. Continued research and technological advancements will further enhance our understanding and ability to protect the heart across all stages of life.